And there was an eye doctor that used to come into the guitar store I worked at all the time with just the coolest guitars. And so I basically decided that's what I would do. I didn't want to work in an office, and I didn't want to do surgery. So I went and shadowed him, and now I work with him every day. I'm an optometrist, so generally routine eye exams, along with some urgent visits and things like that. Most of the time, it's just people that need glasses and contacts, things like that. But we also see patients who see flashes and floaters or have symptoms of retinal detachments. I have a lot of macular degeneration in diabetic patients and some glaucoma spattered in. The first visit is mostly just kind of getting to know somebody's eyes, right? So we dilate them, we check their prescription, we look at their retina, their optic nerve, we make sure that everything is working right. And if it is, then they go on with their prescription and that's it. On the other hand, if we find some sort of disease, then we do further testing or send them to a specialist from there. So I have one patient, for instance, they moved to the city, I think about 3 years ago. And ever since they got here, the whole family's seen me. I think they have 5 kids. And so it's been interesting. I've only been here for 3 years seeing them, but they've been with me since the start. So every year I see their kids get older. Their oldest daughter's going off to college now. A husband is settled into his job at Sherwin-Williams, and the wife has painted the whole house at this point. So it's been cool to kind of see them go from building their house to finishing it, seeing their kids from being early in high school to finishing that as well. It's been fun to go home knowing that I can make a difference in somebody's eye. And in our case right now, I'm working on a research project with telemedicine so that patients don't have to come all the way downtown for their care. And it makes us a little more accurate out at the satellite sites as well. So it's nice to be able to make a difference other than just your routine exams. Primarily my hobbies are guitar and photography. I do both extensively. I play guitar every day. I try to get out and take pictures at least a couple of times a week. Other than that, my wife is also an optometrist, and so a lot of our outside work or outside discussions revolve around work, unfortunately or fortunately. The dinner conversation gets a little boring. And then we have 2 dogs at home. We have a 4-year-old lab and a 10-month-old lab.